So this picture means longitudinal direction of fascia or diaphragms in our body, because the diaphragms in our body have a longitudinal direction. We will treat right now, or we will evaluate also the transversal diaphragms, which are pelvic floor. Then it's diaphragm for breathing. Afterwards is thoracic inlet or outlet. The fourth is the hyoid muscles. And the last one is atlanto-occipital base. So diaphragms or fascia have got many functions in our body. We call it fascia in anatomy, not like diaphragms. So be aware of it. And fascia are covering our muscles. They are connected to each other, so they are connected muscle to each other. They are divided the space in our human body, like for example diaphragm divided thorax and pelvis cavity or space. And first of all, we will treat pelvic floor. Pelvic floor is a floor for our urogenital system or organs, and has got many restrictions through our life. So the placement, the first hand is going between L5, S1. It means the last lumbar column vertebra and the first vertebra of sacrum. So the position is like that. And you can use like orientation the crista iliaca, which the top of this crista is approximately the fourth lumbar spine, so your hand is going a little bit down from that top of the crista iliaca. And the anterior hand is good that your little finger is going down, and the border for you is symphysa or symphyse. So the position of your hand is like that, and then I will tell you what you will do or how you will treat pelvic floor on someone of you. The second position of your hands is approximately between TH-L connection. It means the last column vertebra of thorax and the first column vertebra of lumbar spine. And the anterior hands is going on your diaphragm, or on the patient's diaphragm, and you can touch with your thumb and with your fingers the ribs. I can also show you afterwards on someone of you. And the position for thoracic inlet or outlet, the one hand is going in conjunction between last cervical vertebra and first thoracic vertebra. So you can feel with your fingers the processi spinosi directly, or you are between them, it doesn't matter. And this hand, posterior hand, is mainly for support. And the anterior hand is going under sternoclavicle joint. I can also show you afterwards. So we can describe what kind of signs of release of diaphragms we can feel under our hands. So it's symmetrical direction, or you can feel softening and stretching. You can feel a heat. You can also feel a therapeutic pulse. The pulse, therapeutic pulse, doesn't mean that it's a cardiac pulse of the patient or your pulse. It's a sign of releasing of diaphragms. It has a very, it looks like vibration, so it's going to be very fast, and then it's going to be very slow, or it disappeared. So for you, like a therapist, it's very important to stay with it, feel it, and don't move your hands, and wait until the therapeutic pulse will disappear. You can also, for example, if you are working on pelvic floor, you can feel the flow of fluids, means in the intestine, so there are many movements and noises. Also, sometimes you can feel like your hands are going towards each other. It's like energetic attraction or magnetic attraction. Sometimes also you can, if you have open eyes, you can see like a patient is going to breathe very deeply, or you can see how he's sweating on the forehead, for example. Also, there can be other autonomic nervous system reaction, like rapid movements of the eye. And in craniosacral rhythm, afterwards, when the fascia or diaphragms is released, the craniosacral rhythm should be symmetrical. So before, if you can find at that point that it's asymmetrical, afterwards it should be symmetrical. So if I will repeat it, the signs of release is softening, lengthening, increasing of fluid flow. You can also, if you can feel energy, it's increasing of energy flow. You can feel the heat, also the client or patient can feel the heat between your hands. You can find or feel therapeutic pulse, and you can see or hear deep breath. You can see sweating on the forehead. Sometimes there are some movements of the limbs, means also fingers. And afterwards you can also evaluate symmetry of craniosacral rhythm.